from. Before we start with the presentation, I want to mention that we are recording the webinar. If you don't consent to being recorded, we'd like to ask you to please drop off the call at this time. Okay, and welcome to the Project Firstline Building Capacity for Tribal Infection Control information session. My name is Carmen Sanders. I am a member of the Makah tribe, and I am a public health project coordinator with the National Indian Health Board. I am the project lead for NIHB's Project Firstline Collaborative. My colleague, Courtney Wheeler, is also here. She works on the project and she's here to assist. We are excited to share information about the National Indian Health Board's and Project Firstline. Okay, I'll start out with a little bit of information about the National Indian Health Board. The National Indian Health Board is a 501c3 charitable organization created by the tribes over 40 years ago to advocate for improved health for our people. NIHB is the only national organization of its kind. We serve all federally recognized tribes and advocates on all issues related to health and public health in Indian country. Along with many services, NIHB provides policy analysis and real-time communications to tribes throughout Indian country. We do this work in partnership with our members, the area and health boards, and places where no health boards exist with tribes in the region. A little bit of housekeeping. As I mentioned earlier, the webinar is being recorded. And I just want to add that the recording will be available on our webpage shortly after the webinar is complete. If possible, we encourage everybody to turn on your cameras. Since we're not in person, we want to try to connect and engage the best we can. We do ask, however, that you keep your microphones muted. We'll have time for questions and answers at the end, but I don't mind if you do interrupt if I skip over something, or if for some reason you can't hear me anymore. I don't mind interruptions. If you're having any technical issues, let us know by the chat. We'll do what we can to try to help with any of that. We'll have a webinar evaluation posted in the chat at the end of the session, and we'll have the Q&A at the end, so you can enter any questions in the chat using the Q&A button, or we should have enough time to also, if we need to, unmute and have a chat there. Okay. So this is Project Firstline. Project Firstline is a training collaborative with the CDC for healthcare infection control. The purpose is to create resources for frontline healthcare workers, provide infection control information for healthcare workers, trainings needs, and for collaboration among diverse partners. For NIHB and Project Firstline, we're grateful for the partnership with the CDC on Project Firstline to support the implementation of a national tribal healthcare infection prevention control training collaborative. Historically, American Indians and Alaska Natives have experienced disproportionate mortality rates from emerging infectious disease threats, including the 2009 influenza A H1N1 pandemic. COVID-19 has predictably caused disproportionate impacts to tribal communities, and AI and AN people continue to experience a higher risk of infection and COVID-19 related mortality. To address these gaps, NIHB has implemented a multi-pronged approach to provide infection prevention and control training and technical assistance to tribal health officials and tribal health systems. Our focus is on raising the collaborative capacity of infection control professionals and healthcare providers to undertake infection control practices within their respective scopes of work. NIHB's goal with Project Firstline and the partnership with the CDC is to develop or adapt existing training materials for tribal health professionals to learn more about the important elements of infection control. And so here are some of the activities that we have in support of our NIHB Project Firstline. We have a steering committee. We have scholarships available. We have a tribal infection prevention and control learning community, online self-paced learning modules, job aids, infection control institute, and our infection control infectious disease webpage hub. And I'm going to go into a little bit about each of these. Sorry. Okay, so the first thing we're going to talk about the learning community. This is a list of the learning community webinars that we held in support of Project Firstline. So we recognize that we have a diverse audience of healthcare workers, and everybody serves in many roles and in various settings across Indian country. The webinar topics that we chose for the infection control is based on the feedback that we've received from tribes who have shared information about the topics they would like to learn more about. The recording of the webinars are on NIHB's YouTube and on our Project Firstline webpage. We do continue to plan for future webinars in the upcoming year. Be on the lookout for the announcement for those webinars. And we are planning monthly, and then starting in the next few weeks, actually. Okay, so the Tribal Infection Control Institute. I'm kind of we had the Tribal Infection Control Institute in April of last year during our National Tribal Public Health Summit. And the intent of the Tribal Infection Control Institute was to provide relevant training for frontline tribal healthcare workers and infection control officers. We wanted to provide the opportunity to strengthen their knowledge base and improve IPC practices and provide resources to carry out the work during the COVID-19 pandemic. And we are planning another Tribal Infection Control Institute, and it will take place during the 2022 Tribal Public Health Summit. And the TPHS is scheduled for May 9th or 12th, 2022. Okay, so next I'll go into the application and the RFA that we're here to discuss. Yeah, I'm losing some of my view here, so bear with me for just a moment. Okay, so we'll start out with the eligibility for the application, and we'll go over a little bit of what the RFA is and what is involved. The reason that I started out with the information about Project Firstline is because some of the activities that will be planned for the RFA will also give you ideas of what you can plan. And the sub-award really is to help the awardees with planning some of the similar webinars or training materials or training tools specific to meet the specific needs of your organization. And to be eligible, you do have to be a tribal entity from a federally recognized tribal government, tribal organization, intertribal consortium, or tribal healthcare facility or health system as defined in the Indian Self-Determination Education Assistance Act. So the RFA, the funding amount of the award is $50,000. The funding mechanism is contract with funds attached. We do have 4 awards available. The funding period, this is where we have extended the deadline. So the funding period is from February 24th until July 30th, 2022. Okay, and then with the awardees who are awarded for the sub-award will receive technical assistance, and host webinars and conference calls to support peer learning and connect to learning communities, national networks, existing resources and activities to support infection control activities. So as I mentioned, so these are things that that I'm showing a little bit about what NIHB has planned and done. But this is an opportunity to apply, to use the funds to create the webinars and resources that will fit your needs. Okay, so this is the application. This is the previous version from the previous deadline, but we just wanted to go over a little bit of the information here. There are each section, I will start out with the contact information. So we'll need somebody whoever the applicant is the person designated to be the project manager for their award. And so we'll provide the demographic information, including the tribal affiliation and your IHS service area. And the next section will be your area of expertise. And you can still see that in the, we'll also have you provide an interest statement. So the statement is a 500-word maximum, and you can just describe your interest in establishing an infection control learning community within your healthcare setting for your healthcare workers, and a brief description of the peer learning community webinars or tools that you would find or would use. And we would need you to provide the budget with planned expenditures to complete your activities that you would plan. And the supporting documentation that will need to be provided is a letter of support from your tribe or tribal organization that you're representing. And this one is important here. So these are the objectives to include. So these are where you would list the activities that you would plan on having and using this your award for. And and by completing it, you'd complete the deadline, and then deliverables, the person responsible, and the amount that you would budget for that activity. Okay, so this is so these dates are not current. the application that you have will be will contain the current dates, and we'll go ahead and provide that in the chat as well. We would have have scheduled monthly check-in calls and attend the infection control learning community webinars, the NIHB infection control learning webinars. And we would ask for a presenter to present at our Tribal Infection Control Institute and or a webinar, and attend the Institute, the Tribal Infection Control Institute. We'll be able to confirm a date in the next coming weeks of specifically when the Infection Control Institute will take place during TPHS. And then part of, we'll go back there. So part of the award, we would have one of your staff members complete a CBIC certification. We'll ask for that at the beginning of the grant if awarded, but that will just be the designation of the person who will take it and that who would have to take the certification exam. We would have a mid-year report and also a year-end report. I think we did all that. Okay, so I think we summed up everything there. Let's see. So we did. I know I went over that pretty quickly. I think we can pause here and see if there's any questions. Courtney, I can't see them. If you can, are there any questions so far that we may need to answer before moving on?
Let me see. Okay, I don't see a question. There's just a comment. But the comment's not about the application.
Okay, gotcha. So I think we went over all those. So with the extended deadline, we do need all documents submitted and all sections completed within the application by Thursday, February 24th, and that would be at 11:59 p.m. Eastern time. And the application should be submitted by email with the infection control subaward in the subject line to Courtney, and her email address is cwheeler@nihb.org. And we'll go ahead and we'll enter that contact information in the chat as well. And these are the important dates for the RFA. So the application deadline is February 24th. The award notification will go out on March 10th. And the project period is from March 21st to July 30th. And with the mid-year report being submitted by May 2nd, and the end of year report on July 30th. Okay.
You have 2 questions so far in the chat. I'll read the first one.
Sure.
What is the time frame for this grant?
Okay, we'll go back. So that is the project period is the time frame, and so it's March 21st, 2022 through July 30th, 2022.
And then the next question, could the CBIC certification requirement be for recertification of someone already certified? Yes, that's fine.
Yep. Thank you, Courtney. Yeah.
Sorry, I wasn't sure if you knew.
Yeah, I was like, I don't remember if I read that part. Sorry. Okay, did we have? Okay, did we have any other questions? Oh, yes, I see about the slides. We'll send out the slides and the recording when we send out the survey after the completion of the webinar in the next couple of days.
We have another question. Does the CIC need to be taken before July 30th?
We understand that that is a long process and scheduling may be a conflict as well. We'd like it to be at least scheduled by the end of the grant period, and we'll offer extensions if needed.
So just to follow up, so if you have it scheduled to take in like August 15th, at least schedule it before the grant period's over, even if your test date is after the 30th.
Correct.
Okay, we have some more questions. Where can we see examples of previous awards?
We haven't offered the sub-award out to the tribes. This is new for us. But for the Project Firstline webinars and activities that NIHB has done for the project, those will be on our Project Firstline webpage, as well as the CDC is the main Project Firstline, so they have a lot of resources for infection control training and examples of training, and they also have plans. Oh, I can't remember what they're called though. They have learning plans that you can use if you wanted to use them to create your training in your organization as well.
Where do we get the application? We
will add the application here in the chat, and it'll be available on the Project Firstline webpage shortly. We're still working on getting the updated application there, but we can go ahead and provide that in the chat. If you can send that, Courtney.
Yes, I've uploaded in the chat for download.
Okay, perfect. Thank you.
We have another question. The CIC research now only requires submission of CEUs, not exam retest. How would CIC research fulfill the grant? Do you want me to answer?
Yeah, because I think we can, well, if there's CEUs that have a cost with them, we could use the funding for that as well. If you want to elaborate, Courtney, please.
Oh, no, I was just going to say that we can use, they can use the funds that would cost for the test to take the courses or trainings they need for the CEUs for the research.
Right, and then just in the description area of the application, let us know that that's what's needed is CEUs versus the exam.
I don't see any more questions, Carmen. Oh, never mind. We have another one.
A list of acceptable expenses. Can you answer that one, Courtney?
Yes. So I believe in the application, there's a section that gives examples of what the funds can be used for. If that's not in there, we can, if you email us, we can send out Okay, so under section D in the application under budget, it says what the award can be used for and what it can't be used for. So there's an example, you can use it for dissemination of materials, for implementing trainings. So if you need to, sorry, buy an extended Zoom license where you can have, more than the standard 300 people, you can use the funds for that. If you need to use it for printing or mailing, or you can use it if you want to have like hire a facilitator to do some trainings, you can use it for that. If you need to use it to maybe order some books or software that you want to use for trainings. If you want to like create your own online trainings, like we use this software called Articulate. If you want to use funds to like pay for using Articulate, you can do that. So those are just some examples of what you can use the funds for. Like you can't pay for food since it is federal dollars that we're passing through for the funds for the award. So you can't use it for food and beverages and things like that. Or any type of lobbying or construction type of projects. But if you have any additional questions about what you can or cannot use the funds for, please email Carmen or I, and I'm going to type Carmen's email address in the chat box.
Sure, and I see Rebecca asked for the links for the Project Firstline. Here is NIHB's Project Firstline and the CDC Project Firstline pages here, and those will go out with the slides. I want to stop sharing. I'm not sure. We do have some other fund or availability and activity availability for Project Firstline and scholarships. I'm going to stop sharing and see if I can get that slide to come up. Okay, I think I got it. Let's see. Not sure. I'm still having some technical difficulties here. I don't know. Can you see my screen, or I'm thinking you can't? I'm sorry.
No, you aren't sharing your screen.
Okay. Did it go now?
Yes, we see the steering committee.
Okay, perfect. Yes. So thank you. So I did want to go over some information there too. We are accepting applications on a rolling basis for our steering committee. Our goal is to increase the knowledge and improve practices within tribal health care facilities. We formed the steering committee to help us meet that goal. The members of our current steering committee help us with our infection control managers and who work in tribal healthcare facilities. They assist us with reviewing and developing our materials and on important components of infection prevention and control topics. They are very important to the success of the project because they help us establish the relationship between infection control professionals and tribal health facilities, so or health officials. Their willingness to share their knowledge of infection control as well as share information about their personal and career experiences is really invaluable to us in in supporting our tribal healthcare workers. As I mentioned, we are still accepting applications on a rolling basis. So if that's something else you're interested in, let us know. And then we also do, on top of the CBIC exam for the subaward, we are still accepting applications for scholarships for tribal infection control staff and healthcare workers. The scholarship funding can be used to, can be used for infection control training and courses. So as we mentioned before, if we do have CEUs that are paid for CEUs, we could apply for the scholarship for that. As well as if you had wanted to just, if you're not participating in a CBIC certification as part of the subaward, we can apply for a scholarship for that through here, and we can share that if you're interested in that as well. Go ahead. I'll stop sharing. And I think that's all that I had. If we had any other questions or. Okay, I see Michelle is interested in. I will reach out to you, Michelle, and give you more information about the steering committee. Perfect, that's great. Okay. Yeah, that's great. Thank you, everybody, for those interested. We will get the additional information sent out by email, and we'll have your contact as a registering for the webinar. We'll have your contact information, so I'll get that emailed out to you. Okay, that's great. And Courtney has added the scholarship application in the chat. Thank you, Courtney. Okay, and that's all I have. If we don't have any other questions, or is there anything else that you'd like to say in closing, Courtney?
I am going to add the link to the evaluation to the chat box in 1 second. If you all could please complete the evaluation, it helps us make sure we're providing relevant information to you all. So we really appreciate your feedback. And it looks like we have a question in the Q&A box, Carmen.
Okay, I'm trying to bring that up, and maybe my screens go a little wonky. So let's see.
Can you pull it up, or do you want me to read it?
If you could read it, please. It's minimizing on me.
Dr. Linda Frizzell, I'm sorry if I mispronounced her last name. She is a public health person at a university and a governing board member, and they would like to offer their public health information. She is governor board at the Minneapolis Indian Health Board.
Okay.
Oh, and she also wants to shout out to Stacy, who is our CEO.
We'll get that to Stacy.
Is there a website or a person they should email? If you could share that in the chat box, or you can type it in the Q&A box, and we can get the website or email out to everyone so they can follow up with you if they have any questions or want to see or access to your public health information. And that is for free, the information they have.
Okay, so I'm not seeing it. Okay. Thank you, Dr. Frizzell. Okay. And I think that's it then. So just in closing, we have shared the links, the Project Firstline webpage and application information. And as always, reach out to Courtney or I if you have any questions. If you're working on an application, we're happy to help along the way. And watch out for the email with the recording, the slides, and the links that we have shared, as well as the survey. Thank you.
Okay. We can go ahead and end it if you want.